Bulavinaka and welcome to Gold FM Speak Your Mind. I'm Pedeli Rokotibuna and thank you for joining us again on another show. Now, today's show is about, activism. And it ties in with the 16 days of activism that we have been acknowledging the various, campaigns from various organizations, especially now that endorsed by the United Nations. We've already yesterday marked the World AIDS Day, and we also have more to honor in the days to come. But I'm joined this afternoon by two very beautiful young ladies. Welcome to the show, Taina Naitumbe and Faranisese Ratu. Now, both these ladies, one from Transparency Fiji, and I'm also here to talk a little bit about Youth for Integrity. Now, ladies, welcome to the show.
Thank you.
Now, tell us a little bit about the work that you do in terms of what is Youth for Integrity.
Well, Youth for Integrity, just briefly, is a network of volunteers, young professionals from around the nation.
Mm-hmm.
And so it's a network that was built up to mobilize youth against corruption, because we did a research in 2012, and it was found that 53% of youth that were questioned said that they would practice, they would
in order
be a
to
little
succeed,
shade.
they would actually the integrity, the values would actually,
They would have to compromise it a little in order to get ahead.
Okay.
So that was why Youth for Integrity was formed. But we also have Teens of Integrity,
Mm-hmm.
and so Youth of Integrity is now
well, basically the reason why they had started Youths for Integrity was because of the survey that they found that young people in Fiji and the Asian Pacific faced an integrity crisis, like what she had just explained. And last year, on the 9th of December, which marked International Anti-Corruption Day, we had invited young professionals, because these were youths. Most of the youths are in the tertiary education system and workforces. So we've actually targeted young professionals to come in, and then this year we'd mark our first birthday.
Okay. That's quite an achievement so far, but let's just talk a little bit. You mentioned values and the culture and the traditions in the Pacific region, and what the integrity, Youth for Integrity, is based on is really about what our lifestyle are as Itoke, as Indo-Fijians, as Fijians. Yeah? This is what we uphold a lot. Now, from this survey, how many of this, what age group? Okay, this is the first thing that many have been asking, is what is the age of youth as covered?
well, the target was 18 to 30, but I think according to the national age would be 18 to 35.
18 to 35.
But the youth group that we had targeted was 18 to 30.
Now, looking at what you're basing on and what the work that you've set yourselves, from my understanding, you're under Transparency International.
Yeah.
Now, tell us a little bit about how you're based and what your goals are before we go to your actual event.
Okay. With Transparency International, for us, we're not employed by
Employees,
it's Transparency International, but we normally meet
Mm-hmm.
the youths. We normally meet twice a week, and with this, we've actually been writing proposals to different
Organizations that would fund us.
that
And so we've just recently received some from UNDP, in which, we'll talk about that later. But yes, so far we haven't, but we managed to do a few activities in the past without any fundings. But so we're just making use of the resources that are just around us.
What kind of activities have you done so far?
We have done a poetry slam so far, as well as
visiting
cleaning up.
the senior citizens, cleaning up and visiting them. And with this, we didn't get funds from anywhere, but we actually wrote down asked for sponsors with different organizations like Costulas, Flour Mills of Fiji, and we're thankful that they actually responded and actually helped us.
And Nestle as well, because we need to feed the youths while we're doing work as well.
Okay. Well, speaking of which, what is the criteria for those watching or those listening this afternoon? How do they get to be a part of your movement?
You just have to be a youth, and you have to be eager, and you have to be willing to stand up against corruption. Yeah.
So, are you from different backgrounds and different ages within the scope of 18 and 35?
Yes.
Yeah. So I could also join you.
Yes,
Yes,
if
you
you're below
Would love that.
35.
I love how they
But
say that.
would be
They
really
leave you
good.
down to the age. All right, let's talk about the event that is on December 9th and World International Anti-Corruption Day. A very important one, especially with integrity, Youth for Integrity. What is planned?
Okay. Leading up to the 9th of December, we've actually organized a competition which has activism that would actually help youths send
Okay.
their talents, like if they're for arts or song, they're good in writing down songs.
Express
Yes.
their
Hence why that's why we called it artivism, because of artivism.
I've got a beautiful poster here. I'm just going to show our audience on television. But if you'd like, we're also going to be putting up the link on our website, on our Gold FM Facebook page. So if you can click on that and carry on with the event.
The competition is titled #679 Corrupt Free Fiji. The reason we put 679 is because that's our zip code. And integrity is, well, it seems a bit redundant to say Youth for Integrity because it's catchy. So yeah, we'd love for a lot of people to come. You can make it a family event if you want, because it affects us all in different ways.
Where will the event be?
At Sukuna Park.
At Sukuna Park
yes,
on
we're
the
having
9th of December.
Yes.
What day would that be?
That'll be on a Tuesday, and from 2 p.m. we'll start it's like a fun day where we'll have kids come in and enjoy the day. And in the evening, we'll have the formal event where we'll have the presentation of prizes and also our birthday celebration. And also, as you can see in our poster, Peveli, we have actually included women, rural women. These are the women that are normally not included in all the many events that we
Events and
have.
activities.
Women are not mostly rural women. They are the ones that are always neglected, and so we've included them in our competition too.
All right.
And what we failed to mention was that the competition, if you write in Itoke, you're more than welcome to. If you write in Hindi, you're more than welcome to as well, because
So it's open to all languages and to everyone within the age of 15 to 30. Yes?
to 35. And
We
Yes.
have the
35.
Kachi
And there's also the
category.
Kachi section.
and the
From
youth
14
and
under.
rural women.
All right. Thank you again, ladies. And we'll have you again, okay, on the show. But we'll also put up the link. Unfortunately, we're running out of time for this segment. We'll be right back on Gold FM. Speak Your Mind. Welcome back to Gold FM Speak Your Mind. I'm Pavilion with you. This afternoon, we have been talking about the various activities under the 16 days of activism. And one of the very important ones on the 1st of December is World AIDS Day. Now, many of us think, or may incorrectly think, that this will only involve health officials. But what's something that we at Gold FM have always stressed is that it is an all-encompassing issue. And I'm grateful to be joined this afternoon by the CEO of the HIV board here in Fiji, Ms. Rema Watuwatu. Welcome to the show.
Thank you.
And also the chair of the Fiji Network, or FJN Plus, Benjamin Christopher. Welcome to the show.
Thank you very much.
And, well, first of all, I'll pose our first question. World AIDS Day 2014 had a theme, and the work that you've carried out this year, how has it been for you?
Pinaka, World AIDS Day, the theme that we have for Fiji this year is AIDS We Lose. Why we've picked the theme AIDS We Lose, it wasn't actually a thought behind one person, but it was a consensus between so many key stakeholders in the country. AIDS We Lose is looking at the progress that Fiji has had regarding the response to HIV. The progress in line with HIV testing. The first case that came in 1989. And the type of testing that we had for HIV in the country is not as advanced as what we have now today. So that was one of the progresses that Fiji has had, and that is why we have driven the theme to AIDS We Lose. One was on testing. The second one is on the increase of our voluntary confidential counseling testing counselors who are here in the country, and also those who are counseling mothers as part of the prevention of parent-to-child transmission.
Now, there's a lot of oversight for the general public in
Yes.
terms of this. How have you had to work? Which areas did you have to work harder at? Is it awareness to the community?
One of the areas that we had to work hard at, and I believe we are still working at, is on the reduction of the prevention of stigma and discrimination. And this is where we actually need the support from the community. Ministry of Health cannot do that alone. FGN Plus cannot do it alone. AIDS We Lose is also focusing on reducing prevention of stigma and discrimination in the country. And I believe Ben would also be able to share us more experiences from a PL-HIV perspective on how they had experienced stigma and discrimination when they had disclosed their status during that time until now. From the Ministry of Health perspective, we've seen that stigma and discrimination is reducing. But we hope that someday, as focusing on our AIDS We Lose theme, AIDS is going to lose, that someday we will have zero stigma and discrimination, not only on HIV, but also on other areas in the country, and also zero new HIV infections and zero AIDS-related deaths.
Well, that's quite a goal, and with
It's an ambitious
it's
goal.
a very ambitious goal.
It's an ambitious goal.
But with, like you said, you can't do it alone.
Exactly.
We need everyone else's hand in with this. But I'm just going to quickly cross over to you, Ben, and ask you as you're sitting here, and I'm looking at you, and I'm wondering, how much of a change have you seen in terms of, Ms. Vatuvatu had just mentioned that over the years we've had change in terms of the discrimination you face in terms of coming out. How have you seen it? Is it in terms of the change?
For the changes of stigma and discrimination in Fiji, we have come a long way. Coming out publicly as an MSM who's living with HIV was a double stigma for me. When I came out, the discrimination and the stigma did not only come from my peers, but it was coming from health workers, doctors. So basically, it was coming from within the health sector.
Where you think that it would be a lot more accepting?
I thought it would be a lot more accepting, but in fact, it was the opposite. So basically, we need, I have to say this out, but AIDS We Lose was the theme for this year, but basically, for us, PLHIV, we were sort of disagreeing on this note. Due to the fact, because we were banking on the availability of medications, availability of, from the clinician perspective, we were banking on those things, but we did not think of the perspective of PLHIV on how they think psychologically, on how they feel. So basically, this was if we are to say AIDS We Lose, then we will have the third line treatment. If we say AIDS We Lose, then then we will positive mothers will be properly advised whether to be sterilized or not to sterilize, because basically these are some of the issues that our members come across, and they come and explain it back. So we're sitting there saying, are you saying AIDS will lose, without further consulting those who are living with HIV? So basically these are some of the things that I raised during my speech yesterday. If we are to say this, then basically we need to work together, as was mentioned yesterday. We need to all work together.
Ms. Vatuvatu, how has that? How has the with healthcare and health workers, those involved in that in terms of not only discrimination but in terms of the availability of antiretroviral drugs and care. How are we in Fiji? What's our status?
With antiretroviral care, Fiji, I would say, is lucky in the sense that the state or the government is actually committed in providing antiretroviral care for people living with HIV.
Mm-hmm.
And again, I would like to reiterate the statement that His Excellency the President had stated in his statement yesterday, that the Fiji government is prepared and is committed in providing antiretroviral for our PL HIVs in the country. We haven't, up to date, we haven't had any out-of-stock status of our antiretroviral drugs in the country. Our pregnant mothers, positive mothers, HIV positive mothers, they go on antiretroviral therapy as part of their treatment for prevention of parent-to-child transmission. With regards to stigma and discrimination, I agree from where Ben is coming from. Stigma and discrimination, prevention of that will not go overnight. What the Ministry of Health is doing with support of UNICEF, UNAIDS, and other government and other partners, we are creating awareness within the health ministries and also providing training for our healthcare workers on the sensitization of not only PL HIVs but also our key affected populations.
Well, thank you again. We'll take a short break. Unfortunately, time catches up real fast when we're discussing something interesting, but we'll be right back here on Gold FM Speak Your Mind. Welcome back to Gold FM Speak Your Mind, and today we're touching on, HIV/AIDS, and as yesterday being the 1st of December, World AIDS Day, I'm also speaking with the CEO of the HIV board here in Fiji, Serema Batubatu, and also the chair of FGN Plus, Benjamin Christopher. Now, Benjamin, you've mentioned how you feel about discrimination. What about how your members have been in working together with FGN Plus? How has it been for your organization in keeping your members, or also are some of the members or some of those with HIV who are HIV positive? Do they feel? Do they always feel comfortable coming in, or is there a little bit of reluctance amongst those revealing, or feel that they will reveal their status should they join the network?
For us, there are 72 members altogether for the organization, and joining the organization is not by force. So basically, we work closely with the hub centers around the nation, with whom want to join and whom doesn't. But in terms of our response to HIV and the little bit of work that we do towards HIV, we tend to advocate on our own little capacity that we've built on, basically in our own community, and what we can further do to reduce our stigma and discrimination towards us. So basically, FGN Plus is by PLHIV for PLHIV, an organization which looks after the well-being of people who are living with HIV and trying to get them to another standard in which they can really look after themselves. So we are also fighting at that national level in trying to reduce the stigma, trying to advocate for their rights, and a lot of things that we can do for them.
How much more difficult is it now?
Like I've said, we have come a long way, and still we have a long way to go. And basically, it doesn't take a night to change everything. But stigma and discrimination for all PLHIV comes in different phases. I could not say the same for everybody, but as for me, what I've faced is different from everybody else.
May I ask your personal story?
Yep.
And how did your family take it when you first came out?
When I first came out, my mother was looking at the amount of drugs that I was taking home, and she said, "What are you holding?" I said, "These are my medications." I'm living with HIV. She said, oh, you're okay. But do you know that doesn't really make you less of a son to me. She was there with open arm, welcoming me. From there, then I start opening up slowly to the rest of my family. Then I came out on paper where everybody saw me. So, well, the support was there already. It was just me who did not think that there would be support. So basically, it was just me.
Do you feel, is there, I'm going to, this is a general question I'm going to ask. Do you feel with the way media, the way culture has progressed in the last, I'll say 5 years, where the media of the internet, the social media, and how much of issues that are now instantaneously being posted up, people's Facebook statuses are being displayed for all, even private lives, that a feeling of sort of a laissez-faire, like, you know, a little bit more of less care are being felt by those who take on issues and make HIV less important? Do you feel this? This is a trend that I'm observing that in various parts of the world has become. And HIV and AIDS it has become a little bit more harder for advocates to work in because of the information readily available and how people have just taken information, countless information every day because of its availability on the internet and how we live on it. How do you feel this has affected us here in Fiji? Has it affected us at all?
From a personal perspective, and also I would speak for the Ministry of Health as well and the HIV/AIDS Board. In everything, there's always a good and a bad side of it. In terms of social media, one of the things that we've realized that strategic health communication is a way forward in order to have an impact program. Whether it's on NCD, whether it's on violence against women, even we're talking about HIV and AIDS. So we need to have an impact program. Having the social media, social website, that is a plus, where we have information on HIV, AIDS sent out. But what we need to realize is how informative are these informations and how can this information actually make a change in one's behavior, in one's lifestyle. This is where strategic health communication is actually now a key component of every program in the Ministry of Health and also in HIV and AIDS. It also comes with responsibilities. We have the right to access any information on the website, listening to the radio, reading it. But it also comes with that responsibility and how well we can take in those information and make a decision whether we need to make a positive impact on our lifestyle or not. Our target is on the key affected populations and also especially on the young people, because in Fiji, this is the affected population that we have.
Yeah.
Yes, the young people. We have a challenge, and I guess globally as well, on how we can actually make an impact to our young people so that they can have a positive change.
Now, what is the rate of infection in Fiji at present and the breakup in age groups?
Currently in Fiji, as of September 2014, we have 578 cumulative cases. Now, that doesn't mean the rate of infection ends there. The number of HIV infections in the country continues to rise. And as I've said before, the affected population is within that age group of 20 to 29 years.
Now, that's how many of we have here in Fiji are from mother to child infection. Have we breaking it down, or?
We're currently doing a HIV data verification at the moment from the first case that was identified in 1989. I'm sorry I won't be able to give you a disaggregation of those data. But right now we know that that's the age category that is currently being affected in the country from 20 to 29.
Right, we will have to take another short break, but we'll be right back here on Gold FM. Speak your mind. Welcome back to Gold FM, Speak Your Mind. And today we're talking about World AIDS Day. And as we've had in studio with me, the chair of FJN Plus, and now we're being joined by the chair of the World AIDS Day Committee, Sibuloni Ratu. Welcome to the show. Now, Mr. Ratu, I'm going to ask, I've been speaking with Mr. Christopher here, but I'm going to have to ask you your involvement with World AIDS Day. Now, which organization do you represent?
Thank you, Pedil. I actually work with the Fiji Red Cross, and in my capacity as representing a civil society organization to the National HIV and AIDS board. So that's how I got into this role of chair of the World AIDS Day Committee.
Okay, how much of work that was put in for this year's organization of the day, and in terms of also encouraging more, was there a lot more effort this year, or how do you feel the fight is faring for us here in Fiji?
Well, I would say there was a lot of effort being put together in preparation for this event. We always say that the response to HIV and AIDS is not only the responsibility of government. It is a responsibility of government, civil society, and also key affected population. So in terms of preparation, all these three constituents have actually come together to be able to design a program with a theme that was chosen for 2014, which is AIDS We Lose, of course, including people living with HIV and AIDS. So basically it has been a coordinated approach by the three different constituents, all focusing on the theme to ensure that the campaign is focusing on the messages and the themes that have been chosen for 2014.
What would be other key points in trying to establish for this year's World AIDS Day? What are some of the key points that you wanted to bring about this year?
One of the key points that we have hoped to bring about this year was that if one of the slogans that we used for this year's campaign is that if we work together, we can stop the spread of HIV. So basically, if I refer back to the previous comment I made earlier, was that one of the key points that we have been emphasizing is that the response to HIV and AIDS has to be a coordinated response. If we work together, if we hold hands together, different sectors of the community, from the highest decision-making level processes, right to people on the ground, and even including people who are infected and affected. That has been one of the key focus that we have been trying to drive, and that focus on the theme that if we work together, we can, of course, reduce the spread of HIV and AIDS.
Thank you, Mr. Ratu. Now you bring about that the right of an infected person. Mr. Christopher, I want to ask this. How have your members fared in terms of those who have publicly revealed their status? In terms of getting jobs, or in terms of in other areas such as accessing services, how have you felt? Have your members fared for so far?
We haven't encountered such problems at this time and point, but basically we are basing ourselves from the HIV decree, in which is in place at the moment. So, except for one case that came to our office the other day saying that our office doesn't allow PLHIV to be working in there. And now they have endorsed a memorandum of understanding or something in which they have removed that barrier. So basically it has been a big jump for us, a big move for the organization and for those who are living with HIV in this time and point. So yeah, we are very thankful for that, because slowly by slowly we are removing stigma and discrimination. We are lifting barriers. So and one thing that I've seen, I thought that we have done a lot in terms of our advocacy work. I thought that we are doing enough. But I went to some of the village recently. So when I told them I was living with HIV, they basically left my side.
Really? So you're still encountering discrimination such as this in some of our villages?
Yeah, so I said, okay, I think so. We haven't done enough work. So basically, there is a need to hold hands and work together to try and eliminate discrimination. Because basically, you can say we can eliminate it, but we can work.
We can try.
We can try. We can do it. So these are some of the things that we need to focus ourselves on in trying to eliminate discrimination. Because we are just the same, basically. We're just human. And we also need to be accepted in the community, just the way we are.
Now, with the plans for the people with FGN Plus and your members, what are you focusing on in terms of the work that you're going to have to carry out? Apart from advocacy, is there a specific target also in other areas that you're looking at?
For our members, our aim and our goal is to improve the quality lives of our members. So basically, we looked after our members in terms of their needs, and not basically their daily needs, but medication-wise. Because most of our members are unemployed, so we tend to help. Whatever help we can support them with, a pat on the shoulder that will help, counseling and those kind of stuff. So FGN Plus is there for people living with HIV, and it will always be there.
Now, how much more effort do you think that the public ought, or you hope from the public, in terms of meeting the needs of your organization?
Actually, our organization does need help in terms of funding to continue the work that we do. As we established in 2004, and we have come a long way in trying to maintain the organization, in trying to sustain the organization. So FGN Plus has played a vital role in the response to HIV. Those who started it only started with 8, and now it has expanded nationally. So we are continuing to grow because there's increased numbers of PLHIV in Fiji. Those who want to come in, they can come in. It's open to everybody.
Well, we're running out of time for this particular segment, but we'll take another short break. But we'll be right back with more right here on Gold FM Speak Your Mind. Welcome back to Gold FM's Speak Your Mind with Pepeli. And, we continue our discussion with World AIDS Day. And public assumption over the years have come to think that with the issue of HIV and AIDS being, we've had since the early 80s. And here in Fiji, in fact, our first case, as we heard during the show, and as you may have already known, was, surfaced in 1989. Now, this killer, AIDS and HIV and AIDS, has claimed over 36 million lives across the world. And over the years, here in the Pacific and in Fiji, the perception is this issue of HIV and AIDS has warranted a lot of aid from foreign donor aid. And this misconception, I'd like to pose to, both of you, Mr. Ratu from the World AIDS Day Committee, and also to you, Mr. Benjamin Christopher, the FGN Plus chair. Now, how do you feel about this? How correct is this assumption that a lot of aid is being pumped into, or that HIV and AIDS is an issue forgone its time? How do you feel when someone says this?
Well, thank you, Pedro. I think if that is correct. There is this understanding that HIV and AIDS is no longer a priority. As we could understand this, nowadays there are new issues coming up and there are new priorities. So donors or those who are responsible for giving funding have directed their aid into other areas apart from HIV and AIDS. And we feel that this is not something that should be ignored, and that there should be continuous support provided in terms of the HIV and AIDS response. And if we can recall from His Excellency's statement yesterday at the World AIDS Day commemoration, whereby he mentioned that HIV and AIDS is still on the rise. And if we look deeper into that, into sexually transmitted infections, which makes people more prone to be infected with HIV and AIDS, there are increasing number of STI cases. So this basically shows that there is still a need and that there are still issues out in the community in terms of HIV and AIDS, and then it will continue to be a problem if we do not work together. Then this won't be able to be prevented or reduced. So there needs to be more advocacy provided around getting more resources and support in terms of responding to the HIV and AIDS pandemic. But the important point that we would like to stress is it needs to be a coordinated response, so that we also ensure that the resources are utilized effectively. And these are some of the things that donors are also very particular about in terms of how the resources are being used. Is it reaching the right people that it is supposed to be used for? Is it being used for the proper services for people living with HIV? Is it being used for training for HIV and AIDS, rather than HIV resources being allocated for the response is being used for other things? So these are some of the things too that needs to be considered to ensure that resources provided for HIV and AIDS is used effectively in the country.
Now, speaking of which, with Mr. Ratu has highlighted, how do you feel as a person living with HIV and AIDS, and how much more support that you may need? You've mentioned that resources are scarce with FGN Plus, and also with the needs of your members. How much more? I've asked you this already. I'll ask you again.
On this note, on the running of the organization and the work that we do for the organization, of course we do need funding, and most things that mainly our funding comes from MOH, and most things that fundings are there always. But the thing is, we have to fight for our funds. So we have to do our own proposals. We have to write out, send it out. If we get accepted, we are lucky. If it gets accepted, and if it's not, we're too bad. That's it. We have to try somewhere else. But basically, what I'm trying to say here, we need the help of the nation in order for our work to keep on continue, because we are the face of HIV out into the community. So FGN Plus looks after those whom are living in Fiji, living with HIV, basically, and and we are there as a family. So we have created this atmosphere, this environment where we have become integrated with each other. Everybody is welcome. So yeah, we need to work together in order to...
You mentioned that you also prepare proposals. Obviously, your members also need the training to make these proposals properly, so that you can get get access to these funding. And this is perhaps also an area that you may need for your members. Am I right in assuming that?
We always do an members assessment needs assessment rather. So basically, we try and gather what they want, what they need in terms of their daily living, in terms of what they do in every day. So and also in writing the proposal, we write out the cost of running of the organizations, and what program to be carried out. Our advocacy and our membership officer, they provide their work plan, they provide their cost in everything that they do, because we do members home visit in terms of, because most of our members are out there in the interior, out there deep in the island. So we try to reach out to them and try and give them the support that we can.
How many branches of your organization is in effect here in the country today?
In Fiji, we basically base ourselves in the hubs, working with Ministry of Health. So we have an advocator in the Western Division, and we also have an advocator in the Northern Division and the Central Division. So this is how we branch out ourselves. So they basically hold their monthly meeting in their own division.
With their own members from
With
their
their own members from their own division.
Now, how is the support from the different divisions? Now, you mentioned that you're working with the hubs that are by with Ministry of Health. Now, what other support can you need from what you're looking at? What are your needs in these divisions?
Just to upscale the care and support from the hub centers and other health service, other health care services, yeah.
Okay. Well, thank you again. Now, I'm just going to ask very quickly, Mr. Ratu, what other activities have you got lined up? It's not only about World AIDS Day, it continues.
Particularly for World AIDS Day campaign, we had main commemoration which was held yesterday, and we even had commemoration held in other divisions. Say, for example, in the Western Division, they also marked World AIDS Day, and even in other subdivision like Levuka, even in the maritime zones of Lakemba. So these are the other areas where we have commemoration happening. But there are also plans for post-World AIDS Day activity, which is building on to January, February, to ensure that the response to HIV and AIDS is not only commemorated during World AIDS Day, but it is something that partners and key stakeholders continue to work towards in responding to HIV and AIDS.
Because after all, it is an everyday issue. Gentlemen, thank you very much for coming on the show.
Thank you very much.
And we look forward to working with you and having more to do with the work that you have. And we hope that we can provide the support too. Thank you again. And thank you again to you for joining us this evening. And we'll talk to you again on the next Speak Your Mind right here on Gold FM.